Welcome back. Over 8 million people are now living with HIV in South Africa. That's according to the latest figures released by the Tembisa model. Access to treatment has expanded significantly, with approximately 6.2 million people on antiretroviral therapy. But the number of new infections continues to outpace deaths, driving the overall figure upwards. Joining us now to discuss these findings and what they mean for the country's fight against HIV is the key developer of the Tembisa model, Dr. Lee Johnson from the University of Cape Town. Dr. Johnson, a very good morning to you. Thank you so much for making time for us this morning. So for the first time, South Africa is now above 8 million number of confirmed HIV cases. Tell us about what this model is telling you about that trajectory.
Hi, Aldrin. So there are a number of factors that are driving the high HIV transmission rates in South Africa. A lot of it is due to low rates of marriage, high rates of migration, which mean high rates of partner change. Historically in South Africa, we've also had low rates of condom usage and low rates of male circumcision. Male circumcision has been shown to reduce men's risk of acquiring HIV quite substantially. So all of these factors historically have driven high rates of HIV incidence, and we are seeing the continued effects of these factors now.
Yeah. Does the model indicate to you where the pressure points are in terms of the new transmissions? Because at some point, as the country, we had a major issue with the mother-to-child transmissions. I remember that there were some interventions that were made there. But in terms of the age groups, do we know where the pressure points are?
Yeah, so we still see a lot of the new HIV infections are occurring in young adults. Although there has been a lot of progress made in terms of reducing HIV incidence rates in young adults, they're still the group in which we see the highest rates of HIV incidence. Those mother-to-child transmissions, or vertical transmissions as we refer to them now, are very low. They've actually been reduced very dramatically as a result of getting more women onto antiretroviral treatment. And so that's been one of the success stories, reducing HIV incidence in children.
Yeah, and the reasons for that? This is now looking at the young adults with the new infections. Is it clear what the reason behind that could be?
Yeah, so there's several factors. I think a lot of it is linked to those factors that I mentioned earlier: high rates of migration, high rates of partner change, early sexual activity in the teenage years. And I think those are some of the major factors that are driving the HIV incidence in youth.
Yeah. Then what does that then tell us about the campaigns around awareness of HIV/AIDS? At some point in the early 90s, we used to have campaigns like the ABC, for instance. Schools used to be quite involved as well in the HIV campaigns. Is there been a slow push around the campaigns, or have we reached a level where some people believe that HIV is like a chronic disease and it's something that society is used to and therefore can continue to live without having the fear of being infected with HIV because you're going to get the treatment?
Yeah, that's a good question. So there's certainly been less spending on HIV awareness programs over the last decade or so, and that may be one of the factors contributing to what we think is a recent decline in levels of condom usage in South Africa, especially amongst youth. There's also been a dramatic reduction in the distribution of condoms within South Africa over the last 8 years. And that is almost definitely one of the factors driving these reductions in condom use. So I think the combination of fewer condoms being distributed and less awareness of HIV through social marketing programs and mass media campaigns have certainly been contributing to this trend.
Yeah, and then in terms of treatment, what's the model telling you? We heard earlier on this year actually in February, when the Department of Health was launching the treatment campaign, HIV treatment campaign, in conjunction with the South African National AIDS Council, was that on the 95%, the first 95% of the 95, we seem to be doing well. But once it comes to treatment, that's where we're struggling a bit, even though the numbers are not that bad, but we're not at the 95% of those who know that they are infected being on treatment.
Correct. So I think there's a couple of challenges we face there. I think the first challenge is that very often after people get diagnosed as HIV positive, they struggle to come to terms with that and don't feel ready to engage in treatment and care services. I think there's often a perception that you only need to get treated when you're sick, and many people get diagnosed when they still feel healthy and don't feel that they need to start treatment. Starting treatment is actually early in HIV infection is actually extremely important in terms of preventing the more serious adverse effects of the HIV virus and in terms of reducing the risk of transmitting HIV to others. I think another factor is that often people cycle in and out of care. Often there's high rates of people stopping treatment after they've started treatment. Often clinics are inaccessible, or people struggle to adhere to taking pills on a daily basis. It can sometimes be difficult to access treatment. So I think all of these factors are accounting for why we're not reaching that second 95% target.
Yep. To what extent does mental health play a role in that? Because during the launch of the campaign, the HIV treatment campaign last month, the Senex Civil Society chairperson, Soli Nduku, said that some people are falling out of HIV care due to stigma and ill treatment, but also mental health.
Yeah, so mental health is a huge factor. I think, first of all, it's several studies have shown that people who are experiencing depression struggle to adhere to treatment, and it's a major risk factor for dropping out of treatment. There's also mental health consequences associated with HIV diagnosis. A lot of people, as I mentioned, struggle to come to terms with HIV diagnosis, and often that delays them getting onto treatment. So battling with that stigma, I think, is a major contributor to the mental health problems we're seeing associated with HIV.
Okay, and just finally, some recommendations that you would be making, considering once again that we're also dealing with this issue of the defunding of some campaigns and some programs through USAID.
Yeah, so I think the recent cuts to US funding have been a major challenge for us. Although all of the antiretroviral drugs are paid for by the South African government, the US funding program, PEPFAR, has supported a lot of the staff that support the HIV care services. And without those staff, I think we really are going to see very negative impacts on our program, potentially as much as a 75% increase in AIDS mortality over the next decade. So we really need to focus on plugging the gaps left by PEPFAR, particularly in terms of treatment services and associated support staff.